There we go. Do you have a nickname? Did they give you a nickname?
Who, me?
You.
You want to know what my nickname is?
Well,
Yeah.
My nickname back home is Granny.
All right, Granny, here we go. It's got a little burn here. This is the numbing medicine. Get me a hazmat suit.
Careful, careful.
Yeah. Well, at least I got my jacket on. I'll take it off and have it.
Have you been having fevers and chills, Granny?
Just yesterday and today.
Mm-hmm. How long you had diabetes?
Breathe, baby, breathe.
She's had it for a while, and unfortunately, due to finances, she's not taken any medicines in the last year.
Uh-oh.
So we're going to get her on some. We're going to give her some samples. We're going to get her on medicines that are free or nearly free with her insurance.
There we go.
And we're going to get her on the name of some austerity. I know it hurts more now because I'm blowing this thing up. Okay, everybody step back. This is going to probably cause a little bit of a eruption here. Let me get out of the way here. So you're going to feel a little. If you feel a lot of pain, let me know.
Ooh, wow. What do you think, Jenny?
I love this.
Don't forget Misty.
Okay, Misty, what do you think?
That's pretty cool.
Take a deep breath there, Granny. You're going to feel a lot better when you get rid of this.
You okay?
Well, word okay is probably relative to how much pain she's in right this minute. The pain's going to get better immediately.
It's okay.
Can't believe the doctor would send you away from the hospital with this still intact.
They sent her from the ER. Was it the ER?
Mm-hmm. They discharged her.
And they
This is
said
because her sugar was too high.
they said her sugar was too high, and so they wouldn't release the abscess. They wouldn't drain this. That's just
And the only treatment for an abscess is
to drain it. Yeah.
nothing else works. Sorry.
Yeah.
You can give them all the antibiotics in the world, but unless you drain this dude,
Yeah.
I'm gonna go. Yeah, I'm gonna go a little bit more here.
Is it a lot of pain you're in?
Yes.
Okay.
Bless your heart.
Well, I'm sorry,
No.
but you are
You want to get some more?
one stoic lady.
Some of it's just unavoidable.
Okay, this lady has 5 kids and grandkids. She's a single provider. She can't afford her medications, and we're going to make sure all that's better today. We're going to help her out as much as we can with medications that she can afford.
Mm-hmm.
But other than that, we just want to get this thing drained so that she can. This is just to make you feel better here.
Okay.
It's just some numbing medicine. The drainage is almost done.
Okay.
This is just try to give you a little more relief from the discomfort.
Are you going to pack it?
Yeah, we're going to have to pack this because it's so large. I think I got it pretty opened up pretty good. I'm going to put a couple of, maybe one retention stitch in just so it doesn't have a big gap.
5-0.
Yeah.
Large.
Hey, Granny, I'm Dr. Gilmore. I don't know if I've met you before, but do you mind if I video your procedure?
That's fine.
We'll share it on
Yeah.
online with our friends on YouTube and
Sorry
tell their
about that.
story. It just breaks my heart when somebody goes to the emergency room with a problem and they don't get the treatment they're supposed to get. But you had a good doctor, so he's taking care of you.
The good news is it's all going to get better from here. She is one. I know I'm hurting you a little bit, but we're making some great headway here. This has been here for a long time. The cyst has, and so it's kind of the infection. What it does is it breaks down the lining of the cyst, and so it kind of mushy. And part of the problem with that is sometimes the cyst will recur because you can't get all of it out.
Right.
So, but if that happens, we can deal with that later on. when it's not an emergency like it is right now for you. I know. This has been the okay. So I'm going to get a little packing now. Some packing in here. And all this packing is to make sure that it continues to drain. And we don't want it to, because we want any pus in there to continue to come out. That's the goal, is not to let it build up into a pocket again. Because when it's in a pocket, the body can't get to it. The white blood cells can't reach it, so it just can't get fixed. Okay, good.
Looks great. You got a little tail now.
And then I'm going to put a retention stitch in just because I got a big old gash here and I don't want it to just be too open. We don't like to close abscesses completely because we want them to drain. So we'll put this in here. I'll get the
Is that a 4 or a 5-0?
This is probably 5. It's probably not quite strong enough, but it's going to work all right. It's not 4-0.
It's a 5.
Is it a 5?
Mm-hmm.
Yeah, I could have probably used a 4, but this is all right. As long as it.
Oh, absolutely.
Mm-hmm. Good. So you should feel a lot better. We are going to give you a prescription for some antibiotics. Cut this tip off right here for me. That other side of it a little bit. Yeah. We're going to get you some antibiotics to take. Oh, would you culture this, please? Get me a culture. Let's culture this up. So we're going to do a little culture here. Stitch in here to kind of. Problem with is these blue stitches and black hair, it's kind of hard to see it.
Share yellow. I love yellow.
I know, that would be pretty.
My favorite color.
Cut both ends. Perfect. Alrighty. So I'm going to get you a prescription for some antibiotics. This is going to drain, so you're going to have some drainage that comes out of this. That's fine. We want it to drain a little bit. It shouldn't be a lot, but it will drain some. If this wick gets pulled out, don't worry about it. It'll still drain. But we're going to leave that in. I would like to see this. Well, I'd like to leave it in for a couple of days. So Monday.
Okay.
And we'll pull it out Monday. And I'll get you on some antibiotics, and then hopefully by then you'll have all your medicines on board, your sugars will be better and everything.
Okay.
They're going to clean you up.
Okay.
Thanks for letting us record, Granny.
No problem.
Action! Yeah, move that dirt. Good.
Hey, I'm scared to do some labor.
I don't have to record you, but I'd really like to because you're so photogenic and
No.
you're very happy, and people want to know more about coconut anyway. So tell me what you were going to tell me. Go ahead.
Coconut loves Meta 7,
Why?
okay? Because look, I could not get comfortable for anything last night. I went to sleep at 1 o'clock this morning, woke myself up around 5, and I have been knocking patients out all day nonstop, and I still have a whole mess of energy. Thank you, Dr. Gilmore, for making Meta 7.
Okay, so you took Meta 7 this morning.
Yeah, I
And
take
it's
it every
just-
morning.
You take it every morning. And so even though you had a hard time sleeping last night, you took Meta 7 this morning, and now you are a medical assistant machine.
I am a machine. I'm a tank.
Okay. All right. Thanks for the free testimonial.
Thanks.
Look at those raccoons up there.
Yeah, that's why they're there.
Why are they there?
Because we feed them, and that's what they eat it right there. Is after the coons.
Gators looking for the raccoon.
Yes, that's what they want when they're meeting up.
Those are some big raccoons
Those
too.
are big raccoons.
Yeah. As I said, as a deer feeding them out here, the business. Huh?
Raccoons can get into anything though.
Oh
to eat.
yeah, they're in minute standing. Take nice for y'all to see. You know what I mean?
Oh look, they're coming towards the boat. That gator gonna get them now. That'd be cool to watch.
You're so mean. I think they know they're going to get fed, but I think they also know there's a little bit of danger
You
now.
gotta remember that's a raccoon's natural habitat where you are. Where the gators coming yet? Nope. He just was on the bank. That's what I
Oh, he's
said.
coming.
Here
Right
comes the
there.
gator now.
There he is.
Oh, that gator.
Looking at them coons, huh?
I
He'd
see
like,
him.
he'd like to
He's
get him
sneaking
a
around here.
good meal.
You don't want to get out that water.
Can those coons outrun that gator?
I feel bad if you.
He knows, look, he said he's ironing them up. What I was telling you about when you stop, you see you looking over there. The eye ain't coon up.